So the New Orleans Medical Reserve Corps is really focused on emergency response. As most people know, hurricanes are the major threat to the city of New Orleans. And while many New Orleanians are aware of that threat, they're not always prepared. We've done some studies that show that 41% of New Orleanians do not have an emergency response plan, and 55% of those who are at risk will need city assistance during an emergency. So our MRC unit is really focused on emergency response, but this year we've also taken on the challenge of trying to be prepared for outreach and to make sure that all of our citizens are ready for an emergency. So during the 2013 hurricane season, what I started to notice was I was doing outreach to facilities that called and asked for our assistance and to come inform their clients or residents of hurricane season preparedness. However, many times I would get to these facilities and find out that the Red Cross had been there the week before, or maybe our Office of Emergency Preparedness, or even some of our other volunteer organizations like Evacueteer and CERT. So what we discovered was that all of these groups were going to the same facilities over and over again, and we were not reaching all of New Orleanians. So there were big segments of the population that heard us talk many times and others that we were completely forgetting. I also noticed that we were all using slightly different terminology, which can be really confusing to New Orleanians, especially those that are of lower literacy and don't always understand what we're doing. So this year's project is really going to help us design new outreach materials that are focused on these at-risk populations that are developed for low literacy individuals. They'll be available in Braille, large print, Vietnamese, and Spanish. And they're really going to be New Orleans specific and make sure that all of our organizations are using the same materials and using the same terminology so that we can have cohesive outreach materials. So this year, our MRC unit has partnered with the other volunteer organizations like Evacueteer, CERT, the Red Cross, and the city departments, the Health Department, the Office of Emergency Preparedness, EMS, the State Health Department, Entergy, and RTA to make sure that all of our outreach is consistent. We've developed a calendar so we can invite one another to our outreach events. We'll also be mapping all of our outreach to make sure that we're hitting every geographic region within our city. We will also be working with other organizations to make sure that service providers understand emergency preparedness and are able to do some of that outreach for us. So while this project, a large focus is going into this hurricane season to make sure that we have materials at the end of hurricane season, we'll go through a full evaluation process to really look at the materials and find out if people understood them and what changes we need to make so that we can be prepared for next year. We'll also be trying to expand these materials to include other public health issues like flu season and other power outages and water boils, which are frequent in New Orleans. So we're developing new brochures, door hangers, magnets, postcards, and classroom materials in order to make sure that we have a wide range of printed materials that have a cohesive look to them, that are New Orleans specific, and they're going to be full of lots of pictures and very little writing for those low literacy populations. We've done a lot of work with our community organizations that work with at-risk populations. They're going to be a part of this project throughout the time frame. We've already begun meeting with them to make sure that we're answering the questions they frequently hear from their clientele, and making sure that when we translate the material, they're easy to read, making sure our Vietnamese and Spanish materials are in the correct dialects. These partners have already begun to give us some insight, not only on how to reach their populations, but on how we need to change our emergency preparedness system and response system to really meet these individuals' needs. They'll also be helping us with the outreach, and we'll be doing some trainings for these organizations to really make sure that they can answer questions for us. We hope that through this project, we will be able to improve the resiliency of New Orleanians by providing people with the information about what the city plans to do during an emergency and what they should do as individuals. They'll be able to make better decisions about how to plan and respond to an emergency. Our MRC unit is a rather new unit, and we're still a rather small group. So this has been a great opportunity for the community to really recognize our MRC unit and find out what it is we do. So we've been able to partner with a lot of other community groups and find other ways to collaborate. If I was going to describe our project in 6 words or less, I would say it is making New Orleanians resilient through outreach.